During the height of the COVID-19 pandemic, as fear gripped nations and health systems faltered, one herbal formulation from Uganda found its way into headlines, homes, and history. It was called Covidex. The man behind the innovation, Professor Patrick Ogwang, a pharmacist, pharmacologist, and ethnobotanist who had been quietly studying indigenous medicinal plants for nearly 2 decades.
So at that time, together with the other staff in Barrow University, Dr. Kasim Tolo Umbwa was the director of Farm by Truck. Farm by Truck was a World Bank funded project where we were training PhD students, master students, and doing research on traditional medicine and also biotechnology products. So we formed a team that time to work with the Minister of Health, Natural Chemotherapy, the Minister of Health, and also another researcher called Professor Baruga. We thought that we could look into traditional medicine and maybe find a solution to the COVID, which was now spreading throughout the world. But in fact, in 2020, it was killing many people in Europe and America, seriously. So we formed a team and we applied for funding from government. But the group broke up. So we did not continue working together.
Ogwang pushed forward with a smaller team, mostly graduate students from Barara University, with support from Dr. Kasim Umba.
So at that time we decided to begin doing literature review, reviewing plants in Uganda with the potential to kill viruses but also boost immunity. So we identified 5 plants at that time. 3 of the plants I had previously done work on it before. 2 other plants were new. So now we were looking for funding from government.
But with funding slow, a breakthrough came through necessity. A desperate call from a friend with a patient on oxygen led Ogwang to administer his untested formula.
At Barrow University, people knew that we had a Covidex formula. The staff already knew. So whenever there was a COVID case, whether among students, among staff, they would come to our department and I would give them, and they use and they would recover. So until I think May, when I got a call from one lady, a friend of mine from Entebbe, that she had a friend who works in a bank, and he has COVID, I think in Entebbe, on oxygen, and anytime he can die. The father is a reverend, he's just crying. She asked me if I have anything that can help that man. I said there's a formula that it seems to be working from the way we are testing the lab, and all people are already treated. You go to my factory on Entebbe Road, my lab, I'll tell him to give you, because I bid it from there. So she went and picked 6 bottles of that formula and took to the man. So let them use it, it's safe, there's no harm. After a day, 2 days, she sent me that they have removed the man from oxygen. The medicine is helping him. By Saturdays, like 3 days, 4 days, said the man was discharged.
Soon, demand exploded. But without certification, Ogwang faced criticism, ownership disputes, and potential arrest.
A lady from Entebbe decided to post a question on a forum for ITESO that, Professor, COVID is increasing. Do you have anything for the country? Then I said that there's a formula that seems to be working called Covidex. Then now WhatsApp group took over from there. People begin sharing about it. So at that time, I did inform the leadership of Barrow University that this formula is working. We already organized the team in Barrow University, start producing it from Barrow University. But they were hesitant. Maybe they saw that I was not serious. So when they are hesitant, I decided to come to my lab. I left the university. I came to the lab in Entebbe Road, Arkwright, and I began organizing the team. I came with some of the PhD students and masters that I had to help me in production and so on. So we began producing and giving to the public before we took to NDA, because we still had some data to collect. I couldn't surely wait for NDA because people were already calling me. I already seen the thing treat like 10 people by that time, and they had recovered within 2-3 days, and I knew the medicine was safe. So I said, let us produce medicine, let those who need it receive it as we complete data for NDA. So then eventually, controversy starts. Remember that? The university comes in, arguing that the formula is theirs. NDA comes in, not approved. Everybody was on my neck. But I decided to call a friend of mine. I was a bit scared because NDA has powers to arrest you and take you to court. So I said, now, my worry was not really the arrest, but my worry was they are coming to close the lab where I was producing from. And therefore, people will not get the medicine.
Then a call from State House. President Yoweri Museveni had heard about Covidex. Ogwang explained everything.
I got a call from State House. This is State House. This is Professor Ogwang. I said, yes. Museveni wants to talk to you, hold on. So I remained waiting. And indeed, he says, hello. I said, hello, Museveni. How are you, Ogwang? I said, I'm okay. I'm told that you claim you have medicine for COVID-19. I'm like, Museveni, I'm not claiming, but I have medicine for COVID-19. Are you sure it works? I said, yes. How do you know? I said, I've already tested it on more than 30 people. Do you have their numbers? I said, yes. So he asked me many questions, then he asked for their numbers, seemed to confirm. He said, I'll call you the following day. He called at 10 again. He said, now, one, give me more 2 numbers. I gave him 2 more numbers.
The president asked one question. How can we help you?
I was very happy when he asked, how can we help you? I said, I need one, to increase capacity, because people need the medicine, but don't have capacity to produce enough. We are lacking bottles, because we are running short of bottles. And as I told him, I also need security for the factory and for myself. I said, okay, Madam Nacho is going to call you for money that you need, any help you need, and also I'm going to inform General Okech to give you the security you need. And indeed, I was called by General Okech, and also Madam Nacho called me. And I met them, and they gave me the help I needed.
Even as profiteers sold Covidex at inflated prices, Ogwang took to TV to defend the public interest.
And I was selling at 3,000. Then I increased to 5,000. I don't know if people were selling at 20,000, 50,000, 100. Until someone called me and said, Professor, go on TV and inform people the price of Covidex. People are being exploited. That's when I went on TV and said, Covidex should be sold. We are selling it at 5,000. So sell at 10 or 20 maximum. Then someone called me like, Professor, go back to the lab. Leave the issue of price to us.
Now, Covidex ranks 4th in sales among Ogwang's products. His top sellers, Jenna Cough, Jenna Acid and Jenna Flu, target other common ailments.
I met the professor in Kenya. She told me she works Covidex in her pocket. Tanzania, Rwanda, Congo, Ethiopia, Nigeria, Canada, USA, Germany. I have reports of that. People use those medicine all over the world. And it helped people to recover from COVID-19. Up to now, some people still use it for cough and flu and allergy.
Ogwang now hopes government can empower traditional healers and herbal researchers to do more.
NDA brings their staff here, their people here. Herbalists are brought here to learn from us. Even this morning, they are here, brought by National Authority. So they learn from us how to develop the herbal medicine sector. Yeah, so I'm grateful for the support that I got from Ugandans as well. I think Covidex was defended by Ugandans. If it was not for Ugandans rising up, it was going to be destroyed. But Ugandans stood up and said, this medicine is helping us. NDA helped Professor register the medicine. But for us, we are using it and helping us. And my mother was not educated by formal education. But she knew a number of medicinal plants, herbs, that could help people. One that I'm very sure of, she had the formula for helping women who could not conceive. to conceive and get children. I know so many ladies in our village who could not produce children, but mommy gave them medicine and they produced children. And they will name the girls Jenna. Her name was Jenna. So if you go to my village and ask for Jenna, you find many people called what? Called Jenna. Because that formula will help women to produce children. Unfortunately, she passed on without me knowing the formula. I was still young. So I missed that formula, and she never wrote it down. But also when we were sick, she had roots in the house, above the fireplace. You come from school, you're crying with stomach ache, vomiting. She goes and picks those roots, scrubs for you, she pounds, puts hot water, you drink morning and evening. The following day you're back to school. Whether it was malaria or food poisoning, whatever it was, we would use our medicines.
From humble roots to a household name, Professor Patrick Ogwang's story is one of belief in science, in tradition, and in the power of homegrown solutions. Walter Mwesije, NTV.